Hello, this is Alphonse Roeks once more. Today we are presenting clinical skills in obstetrics, measuring the blood pressure and how to examine the pregnant woman's abdomen. When we measure the blood pressure, standardization is essential. The woman should be seated with both feet flat on the ground. We have to ensure that we use the right size cuff, and the right upper arm should be at the level of the heart by either placing it on a pillow or the practitioner supporting the woman's arm. We use for the diastolic blood pressure, we use the Korotkov sound 5, which means the tones disappear completely. If that's not the case, we use the softening of the sounds, which is Korotkov 4, but 5 is the standard. Now we have some video fragments which demonstrate it very clearly. When measuring the blood pressure, it's paramount that we use the right equipment. So what we have here is the blood pressure cuff. This is the regular size we use at our hospital, and this is the cuff which is offering a larger size. So if you have any doubts, measure the circumference of the upper arm to make sure you use the right cuff. If not, if you use a small cuff, you will get false positive hypertension. So paramount to use the right equipment here.
Come in. We're going to check your blood pressure today, right? So we'll make sure that your feet are, the distance is appropriate. Your feet are resting on the ground and the arm is rested. Is that okay? And then we use a right size cuff, which is very important. Yeah. So use the correct size cuff which fits the arm. Mid-arm. And then support the arm. So if you support your arm there, on my hand, if you support it, and then measure the blood pressure.
Now the next step is examination of the pregnant abdomen. Standardization again. First, we discuss and present palpation of the abdomen using the so-called Leopold maneuvers. Secondly, where and how to confirm the fetal heart rate. And thirdly is how to measure the fundal height with a tape. Palpation. I am an advocate of using the Leopold maneuvers. Christian Gerhard Leopold was a German gynecologist who, around the turn of the 1900s, described in his textbook for obstetrics how to palpate the abdomen in a structured way. I'm a great fan of this. When I hear people telling colleagues just have a feel around, that means the risk that you miss what you really want to find out. When we palpate the woman's abdomen, there are a few questions which we want to answer. So our fingers will be trying to answer those questions. First is, what is the presenting part which is closest to the pelvis? Is it the head, or we call that cephalic, or is it the breech? Second question, what is the fetal lie? Is the spine of the fetus parallel to the maternal spine? That's called longitudinal. When both are in a 90-degree, so if the fetal spine is perpendicular to the maternal, it's transverse, and somewhere in between it's oblique. The next question is the fetal position. Where is the fetal spine? Is that to the maternal left, to the right? That's important, especially when a woman is in labor. And we also know, when we know what the position is, we know exactly where to place our doppler when we want to listen to the fetal heart rate. The fourth question is the presenting part engaged? Is it down into the pelvis? The first maneuver. Before we commence examining pregnant lady, we ask her permission, make eye contact, cover her legs with a sheet if need be, make sure that you're aware of cultural differences here, and be gentle. It's a motherhood statement, but it needs to be confirmed. Here, after rubbing your hands with alcohol gel to disinfect them, you place both hands on the upper quadrant in the left and right hand side, and you bring your hands closer together until you feel the fundus, and in the fundus the fetus. Now you tap alternatively with your right and left hand, keep your fingers closed, and you ask yourself, what I feel between my finger tap? Is that bouncy? Is that balloting? Like the feeling you would have if you would try to submerge a ball underwater, or move everything as one package? This latter means you are dealing with the baby's breech. The second maneuver. Now with our hands in the same position, come down, and you stop roughly on the left and right hand side of the umbilicus. Now with your fingers slightly spread and the fingers spread slightly open, you press, you do deep palpation, left and right hand side, and you ask from your fingers to tell you where do you feel a firm part. Where you feel the firm part, that's the baby's spine. Where you feel small parts who move away between your fingers, that is where you feel the limbs. So that answers the question where the baby's back is. Now the third maneuver, here is where we try to find out, firstly, is there a presenting part? And secondly, is it engaged? Is it already down in the pelvis? Now only with our right hand, we open our hand and we oppose the thumb to the four fingers. The fingers remain closed, and almost in a vertical way you go down just above the pubic bone and you squeeze. You try to close your fingers together, and usually your fingers encounter a hard part. That means you confirm there is a presenting part. And then the next step is with your fingers you move slightly up and down as represented by the yellow arrow, and that will tell you if how far the presenting part is engaged. The fourth maneuver I present here very briefly. You move now with your hands in the opposite direction, 180 degrees, and when both your hands above the pelvic brim converge, that means that the head is not yet engaged. When your fingers would diverge, that the fetus is down into the pelvis. I personally don't use that maneuver anymore. That's why it's between brackets, because the second part of this third maneuver gives me exactly the same information.
And can you show me your tummy? Thank you.
Is the head engaged or descended into the pelvis? The word engaged is a little bit funny, but this has nothing to do with any plans or commitments for a future wedding. Here on the left hand side, top panel, we see the head is not yet engaged. Blue is the pelvis, the bony part of the pelvis, and we see the head is completely floating above the pelvic inlet. It's 5 finger breadth palpable, so 5/5 means it's not yet engaged. On the other hand side, to the right, lower panel, right hand side, the head is now almost completely already inside the pelvis, and only 1 finger breadth is palpable. It's 1/5. So the 5th refer to finger breadth. Yeah, obstetricians use funny descriptions.
Yeah. So just washing my hands. So I'm going to do 3 maneuvers to feel your baby's position, okay?
nó không mệt tim thì tôi hành tim.
So this is Leopold 1. And it feels like baby's bottom's up the top, which is good. And Leopold 2, just feeling the abdomen down the side. And Leopold 3. And the presenting part feels very much like a head. I'm sorry, a little bit sore. And it's not engaged in the pelvis yet.
Summary of Leopold 1 to 3. The first maneuver, both hands in the frontal area, tapping alternatively and asking yourself, what do I feel between my fingers? Is it the bottom or the head? Second maneuver, para-umbilical area, deep palpation. Where is the baby's spine, the baby's back? The third maneuver, only one hand, delving somewhat deep into the pelvis. Please apologize. You've asked yourself, do I feel a presenting part? And by moving your hand and finger up and down, you determine the level of engagement. Now confirming the fetal heart rate by using a Doppler device. We will discuss where we listen. Firstly, in the first trimester, commence just above the pubic bone in the midline when the lady is 12-13 weeks pregnant. And as pregnancy progresses, you move slightly up. 20 weeks, the ballpark is just a little bit below the umbilicus. You position your probe perpendicular in the midline and start listening. After 24 weeks, and particularly in the third trimester, usually the heart can be found on the left and right hand side, in the left iliac fossa or the right iliac fossa if we're dealing with a cephalic presentation. And that means you position the probe close to the fetal shoulder and the fetal heart. And you can use this, by the way, to confirm what you thought, what your findings were with Leopold 2. So if the fetal spine is on the left hand side, you will find the fetal heart most clearly in the left iliac fossa. How? Take the dot tone or the Doppler probe, apply some gel to the tip, and then start in a neutral position. In the first trimester, perpendicular to the skin in the midline, apply a bit of pressure, and then you switch the Doppler on and listen for a few seconds. If you can't hear the fetal heart sound, important, don't start moving around with the Doppler, just slowly change the angle, first maybe from the left to the right, and then next up and down. So you search in the same plane, you do it systematically. The fetal heart rate is a typical galloping sound. If your ultrasound beam hits the umbilical arteries, you will hear typically a whooshy sound, a typical vascular sound. The fetal heart rate should be between 110 and 160 beats per minute. Please, when you confirm the heart rate, pause for a little moment, make eye contact and make sure that the mother is smiling as well. This is probably the most important moment of an antenatal visit for her. Here we see depicted once more what the neutral position is in the third trimester, perpendicular to the skin, but it's slightly inward and slightly upward because there's where you expect the fetal heart to be. If you use these steps, you will be most likely be able to hear the heart quickly. If not, don't panic, try very gently. If not, ask a most senior person to help you, and if the heart is not being audible with the Doppler, we will always do an ultrasound scan to confirm fetal viability. Here you see depicted another Doppler machine. In the middle, the green button is the on and off button, and what in front is the Doppler probe. Here another Doppler, and here is Kate Walsh indicating the on and off button and the volume switch and how to apply some gel to the probe.
Yep. So I'm just going to auscultate the baby's fetal heartbeat using this Doppler. So I've ascertained that the baby's head is down in the pelvis and that I think the baby's back is running along the maternal left. So I'm going to put the Doppler in the neutral position, just halfway between the umbilicus and then the aces. That's baby's heartbeat. Good strong heartbeat. Awesome.
The third chapter, measuring the fundal height. Important to know, because that will help us to detect the small for gestational age baby who is potentially at risk. We measure from the top of the uterus, we measure actually from the pubic bone on the right hand side to the top of the uterus, and I'll show you how it works in practice. The mother is semi-recumbent with an empty bladder. That's the first step. We cover her legs if required. With the left hand we palpate the fundus. By depalpation, by moving your hand up and down, you can feel the so-called uphill part of the uterus. Then we fix that with the middle finger and with gentle pressure. So we secure the tape with the left middle finger. Then we move down, and as depicted here, we keep the finger, just our tape between the index finger and the thumb, and with our thumb we probe for the pubic bone. Make sure you confirm this is the top rim of the pubic bone. This is always sensitive. Women will always respond, so please apologize. And as soon as you have your measurement, you turn the tape around and you plot your measurement in the customized Fundal Heigth chart. If the uterus is not in the midline but slightly deviated, you don't displace the uterus or don't push it back into the midline. You measure slightly diagonally as is depicted here. Now we're going to look at a couple of videos in daily practice. We see here Dr. Sam Fitzgerald explaining the measurement of the fundal height, turning the tape around.
And the top of the fundus, like that. And turning the tape upside down. And resting right at the top of the fundus underneath my third finger of my left hand, confirming where the pubic bone is, and just letting the tape gently rest across. And turn it over, a single measurement of 40.
Obstetric examination, in summary, 3 Leopold maneuvers are sufficient to determine the fetal lie and position to confirm there is a presenting part and whether it's engaged or not. We know as well how and where to listen to the fetal heart rate in the most efficient way and how to measure the fundal height. If we all do this systematically and are prepared to standardize, I would think we as a team perform better, and moreover it's less confusing for the woman involved. This concludes our obstetrical clinical skills video measuring the blood pressure and obstetric examination. I trust this will help you to feel more confident in daily practice. I would like to thank for helping me with this video Sam Fitzgerald, Anna Pam Perengi and Kate Walsh, and from the University of Adelaide, Trisha Francescilli and Colleen Ortega, who did some editing. And last but not least, my Zen Master in Chief, Jimmy